Stem cells and exosomes, two powerful tools in regenerative medicine. But which one is better? Stem cells are the body's master cells. They can repair, replace, and regenerate damaged tissues. Exosomes are like tiny packages sent out by stem cells. They carry healing signals, proteins, RNA, and more, to damaged areas. These may seem like they perform similar functions as the stem cells, but they are pretty different. Stem cells, on the one hand, can transform into any required cells and stimulate the body's immune response. On the other hand, the exosomes contain messenger RNA, genetic information, and proteins. While stem cells can become different types of cells, exosomes act faster and may carry less risk of rejection or tumor formation. Some doctors now use exosomes for conditions like joint pain, inflammation, and skin repair, especially when cell-based therapy isn't ideal. So, are exosomes better? Not always. It depends on the condition, the patient's needs, and the treatment goals. Both have unique benefits. The best choice? A conversation with your doctor.